Should I go for the next? Now the next is Dr. Nayana G. I don't know. Nayana G. Okay. She is going to present the acquired Brown syndrome, a rare case series.
A very good afternoon.
Good afternoon.
A very good afternoon to one and all. I'll be presenting a series of acquired Brown syndrome, which is a rare case series. So, as we all know, Brown syndrome is a rare ocular motility disorder characterized by limitation of elevation in adduction. Usually, it presents as a congenital entity, but can be acquired also. That may be caused by trauma, surgery, neoplasms, or any inflammatory diseases or infections. And acquired cases are rare, especially in the pediatric age group. And we present a series of 4 cases of acquired Brown syndrome with the varied presentations. So first one was a 3-year-old male child presented with complaints of acute onset of difficulty in the elevation of right eye. So there was a history of recurrent short episodes of restriction of elevation and elevation in adduction for the past few days associated with an abnormal head posture. The child was complaining of hearing a click before the occurrence of each episode, and there was a spontaneous recovery after a few minutes. So coming to the history, there was a history of similar episodes at the age of 2 years, and he was diagnosed as a case of acquired Brown syndrome during that time. A detailed lab workup and inflammatory workup and myasthenia workup and an MRI was done at that time, and all the reports were normal. He was started on steroids and pyridostigmine at that time by the neurologist, and the child improved after 2 weeks. So at that time, he was diagnosed as an acquired idiopathic Brown syndrome, according to the records. So after 6 months, again a similar episode was noted. So the diagnosis became recurrent idiopathic acquired Brown syndrome, and now it became intermittent. So examination showed a chinna posture with a head tilt, and there was right hypotropia. And FDT was done, and it was positive for elevation in adduction. So all the blood routine and the ESR and the other inflammatory workup was within normal limit. MRI brain and orbit was done and was normal. Test for myasthenia was negative. RA factor was negative. And so a diagnosis of recurrent idiopathic intermittent Brown syndrome was made. So according to our knowledge, it was the first case of recurrent intermittent idiopathic acquired Brown syndrome in the literature. So he was given 1 course of steroids and is under follow-up, and now he is improving. And the second was a case of 4-year-old male child presented with complaints of abnormal head posture for past 1 year. There was no history of trauma, fever, headache, or other inflammatory signs. He was treated with 1 injection peritrochlear steroid 3 months back from elsewhere, and the symptoms were persisting. So ocular evaluation showed marked chin up posture with face turn, and elevation in adduction was restricted. Blood workup and MRI was normal. FDT was strongly positive for elevation in adduction, and we corrected it surgically as it was already 1 year, and superior oblique silicone band expander was done. Postoperatively, the head posture and the elevation in adduction improved. Third one was a 20-year-old female. She presented with complaints of acute onset of double vision on the next day following delivery. It was a normal vaginal delivery. No signs of eye pain, headache, or ocular trauma was there. Ocular examination showed mild chin up posture with mild face turn to right and left hypotropia. And the FDT was done, and it was positive for elevation in adduction. Blood investigations and imaging was normal. She was given 1 course of oral steroid, but it was not responding. So she was planned for peritrochlear steroid injection, but she was lost to follow-up. This was the first case of postpartum Brown syndrome in the literature, according to our knowledge. So last one was a 5-year-old female child presented with complaints of occasional squinting for past 1 month. There was no history of trauma or fever, no history of other rheumatological conditions. On ocular examination, there was restriction of elevation in adduction for few seconds, which improves by itself after few seconds. And mild conjunctival congestion and minimal pain on the elevation in adduction was noted, and mild tenderness was there in the trochlear area. Blood reports showed an elevated ESR. Rest of the blood tests were normal. MRI brain and orbit was normal. She was treated with oral prednisolone, and the symptoms improved over a week. So to conclude, acquired Brown syndrome is rare and the presentations are variable, and the treatment should be individualized for each of the case. Inflammatory markers and imaging should be done in all cases of acquired Brown syndrome. Thank you.
But I think we agree wonderful cases
Sir.
if it be correct.
Sir.
I know that. Have you done any ultrasound during the normal period? The
B
normal,
scan we have done, sir.
any, no
In the
finding?
in between the episodes, especially for the intermittent cases, we have done the B scan, but there was no other findings, sir.
How can you explain then the intermittent stage?
Sir, only in
And
the
what may be the reason?
in the literature I could find
Now,
only.
forget the literature. What do
Sir.
you think in your cases? Why this is intermittent? Because once you say that the Brown syndrome is there,
Sir.
so how can you say that is intermittently? Sometimes it's normal, sometimes it's
But
down.
I have the video
Like the
also, sir,
intermittent
but
exotropia, I
it
don't
was
know.
coming like that. And in the first case, the child is even feeling that click every time he's
No, the
getting that
fibrosis
episodes.
cannot go even in between, whatever may be
Sir,
the.
but maybe some
regions.
inflammatory, it may
The
be
region
due
may
to
be-
the inflammation,
If it
sir.
may be the inflammation, that must be, you should know that what kind of inflammation is there,
Yes,
and
sir.
does it respond to the steroids or any
Yes, sir.
inflammatory
Except one case, all the other cases were responding to steroids, sir.
steroids?
Yes, sir.
What dosage you were giving?
Sir,
What dosage you were giving?
1 mg per kg, madam, in tapering doses we gave.
Okay, and did you evaluate the sinuses also?
Yes, sir.
So how was it?
MRI first we have done, so any signs of sinusitis we could get in that also.
Yeah. So in such cases with Browns, you should treat the patient for sinus also.
Yes,
Because
sir.
sometimes frontal sinusitis
Yes, sir.
may lead to acquired Browns. So this should
Yes,
be
sir.
taken care of.
Ethmoid and frontal sinusitis can cause acquired Brown syndrome.
I think she has a very nice presentation and very good, nicely conveyed everything.
Thank you, madam.
Have you done any surgery also? No.
Yes, sir.
You have done
One
this?
case, silicone band expander we have done.
Yes, they put. In the second
Silicone
case, they put.
expander. But all the three cases were intermittent type, as you are saying. Sometimes they are normal,
No, sir,
sometimes
that one case was constant, one was intermittent, and one was only for few seconds it was staying, and beautifully it comes back, sir. So,
Okay, so the one who was constant, you have done the.
yes, sir. For that we have done the surgery, sir.
Okay.